Hello guys, my name is Abdul. I am a family medicine specialist. I was asked by my client, who is a creative writer, to talk about a medical topic which supports him in his creative writing, and I selected the topic of Bionic. Those are some abbreviations of some of the items included in our topic: FDA, MIT, RO, which is the reproduction rate of contagious disease, and a famous disease which we discuss, the so-called retinitis pigmentosa. ER is an emergency room. Uh, Actually, my client put in front of my eyes some parameters, including the magic, the so-called the black energy, dreams, genetics, and medicine. I assured him that I will discuss the point which I can discuss in detail, and I noticed that he is content with the bionic, the medical topic, which is suitable for him. The discussion of bionic started since about 20 or 30 years ago, but the final goal of the bionic, which is the eye bionic, it was only 2017. That's to say 3 years before. Here we can look at the bionic foods, where we can pick the microprocessor, the computers, and the motors. In this picture we can see one of the athletes. His name is Pistorius. Pistorius was born with congenital anomaly in the both feet, and he was amputated bilaterally and was replaced by a bionic legs. In spite of his bionic legs, he shared in a championship with the abled ones, and he preceded them. Here in this picture we can see Mr. Aline. Mr. Aline is a retinitis pigmentosa patient. We will discuss his case in detail later on. We, in the picture, can see he is cooking in the kitchen. This is a wonderful cooking because he lived for 30 years completely blind. Regarding the genetic point of view and the bionic, we can discuss the retinitis pigmentosa as an isotype because it is a genetic disease affecting both eyes, and starting early in life, the disease is progressive and leads to so-called the tunnel vision. That is to say, the patient sees the center of the skin only without the peripheries. Later on, it progresses to complete blindness. Here is the picture showing the so-called the tunnel vision of retinitis pigmentosa patient, where the peripheries are completely unseen by the patient. Here is Mr. Aline, above 60 years of age, with his new glasses. That new glasses are supported with a video camera, microprocessor, and that was preceded by an operation inside his eyes. That operation was an insertion of artificial retina inside his eyes. Through those artificial retina, the signals can be transferred to the brain and he can see. Another picture for the tunnel vision of retinitis pigmentosa patient, where he can see the center of the skin. For the peripheries he cannot see. Here is the training of the amputee. This bionic can do the same movement of the normal foot, but not all of a sudden. It initiates training. We here look at the cables coming from a myoneural junction and extending to the different joints of the artificial foot. That impulses originate from the so-called reimplantation surgery, where surgeons reimplant the proper nerves into the proper muscles at the junction of meeting between the so-called agonistic antagonistic muscles that triggers some twitches at the amputated stump, and those twitches are transferred through the electric cables into movement to the artificial foot. With training, he can accommodate the angles and the power with the normal one. Dutchman is the first American who utilized from Bionic. He was affected with cancer in his left upper arm, and surgeon tried repeatedly to correct his disease, but in vain. That was followed by about 30 irradiation sittings. The result was insufficient, and they decided finally to amputate his arm. We can see in the picture that he is able to wear the cap of his pipe technician. He is able to move his elbow joint, his wrist joint, his finger joints. Apparently in the skin we see him happy. Here we can see the bionic hand can pick a coin firmly. That of course occur after training repeatedly. Here another skin for the bionic hand, where the patient can use a key in a lock. In the same way, the bionic hand can count a paper currency. The bionic hand here can use a scissor. That girl is a British girl. Her name is Telly. Telly was affected in her early childhood with a disease called meningitis, and the disease was complicated by sepsis that resulted in gangrene of both her hands. Surgeon decided to amputate her hands. Her mother promised her to compensate later on. Here is Mr. Aline, above 60 years of age, with his new glasses. That new glasses are supported with a video camera, microprocessor, and that was preceded by an operation inside his eyes. That operation was an insertion of artificial retina inside his eyes. Through those artificial retina, the signals can be transferred to the brain and he can see. Here we can look at the bionic foods, where we can pick the microprocessor, the computers, and the motors. That girl is a British girl. Her name is Telly. Telly there is some stories about Bionic actually. We can look here. We can look at the Bionic foods, where we can pick the microprocessor, the computers, and the motors. This is Tilly, while infant. We can see in the picture her gangrenous hands, and she was amputated bilaterally and received about 10 blood transfusions in the ICU. This is Tilly at the age of 12 years old. Tilly is talking through broadcasting station. She is talking about her history with Bionic. We have also another story, the story of Adrienne, who was a dancer, and unfortunately she was amputated after a terrorist attack for one of the nightclubs in USA, and she was replaced by a Bionic foot and returned back to dancing. And the last one is the Hig Hair, who is a pioneer actually in Bionic. Hig Hair was climbing a mountain from early age, and unfortunately there was a snowstorm, and he fell from the mountain and lost for 3 nights in between ice, and as a result he got frostbite and was amputated bilaterally. He was replaced by Bionic. Hig Hair is the pioneer because he finished his study in engineering and in biophysics and became a professor. Hig Hair has about 200 scientific papers peer-reviewed and 100 patents. Here is Adrienne after returning to dancing. We can see her bionic leg. This is Tilly at the age of 12 years old. Here are the references for the topic, some citations.